Hi, and welcome to the How to Survive Healthcare podcast. I'm your host, Kayla Thompson-Riviere, seasoned critical care RN turned independent patient advocate. Tune in every week so that you can learn the things about the U.S. healthcare system that no one ever tells you. That way that you can get the most from it and optimize your health outcomes. Now, of course, this podcast is strictly to inform and entertain and should never be taken as a substitute for medical advice. Let's dive right in. Hi, and welcome to another episode of How to Survive Healthcare. I'm your host, Kayla Thompson-Riviere. When I was brainstorming about what to do this episode on, I realized that through the episodes I've launched, I never did one that was just about what is patient advocacy, about what I do as an advocate and my business Heard for Life. That's because prior to launching this podcast, I actually started a weekly live stream in my Facebook group, also called How to Survive Healthcare. And the first time I did that introductory video. And then I just continued moving forward with my topics when I transferred to doing the podcast. So that's how that got overlooked. But anyways, here we are today. So what is a patient advocate? I just want to start with that. So a patient advocate is anybody whose role is to help patients get through the medical system or help them navigate some sort of issue within the medical system. Now, you see patient advocates a lot in hospitals and in insurance companies. The thing that sets apart an independent patient advocate from people in those roles is that at the end of the day, those people employed by the hospital and by the insurance company, they really are tied to that facility. So they can't do or recommend anything on behalf of the patient that's going to go against the facility or the insurance company. Which that may sound a little bit confusing because you would think that what is good for the patient would also be good for the facility and for the insurance company. But sadly, here in the real world, sometimes it doesn't work that way. In my experience as a registered nurse, the only time that I've seen the hospital patient advocate get involved is when something had gone wrong and there were errors in a patient's case, and that advocate was brought in truly with the goal to keep the family from suing. So not exactly a role that is 100% there fighting for what's best for the patient. It sort of has a different end goal. There's some overlap, but not exact. An independent patient advocate, on the other hand, we really focus in on that independent word. So for me and my business, Heard for Life, I'm self-employed. I do not work for an insurance company, a hospital, a doctor's office, nothing like that. When I work for a client, the client is the one who's financially responsible for my services. So that means, like everything else in America, follow the dollar and you see where loyalties lie. So when you're paying me directly and it's not coming from health insurance and it's not a benefit from somewhere in the community, that means that you're the boss, you're in charge, and I work for you. I'm here to serve you and what is going to be best for you, even if that does mean fighting with doctors, facilities, insurance companies, pharmacies, whatever it takes. So that's the true benefit and power in independent advocacy, and why I feel so passionately that for the good of the patient, it should stay a self-pay service. Now, that may sound a little harsh because not everybody has that kind of money laying around. And I hear you on that. And that actually, it does bother me that my service to people is sort of income restricted. So two things. Number one, that's a big part of the reason I put out this podcast, so that I can share what I know and help people who aren't in a position to afford services like this. Secondly, I have goals and aspirations in the future to set up and also manage a nonprofit in association with this, some way to raise funds that I can sustainably provide services on an income-based sliding scale. So that will be coming down the pipeline in the future. So watch out for that, because I would love to see this service become more equitable over time. It's clearly something that everybody needs across the spectrum. This isn't something that, only happens to higher income bracket individuals. That being said, there are Medicare is now covering some advocates, but my concern with that is, just like I have voiced before, insurance companies already have patient advocates, but at the end of the day, when decisions are being made about what kind of services or care a patient is going to get, if you're employed or paid by the insurance company, then you have a bit of an association to keep the best interest of the insurance company, which once again is not always what's in the best interest for the patient. So that's why for me, that's not something that I'm working with, because the whole goal of moving from bedside nursing into independent patient advocacy is to be able to advocate for my patients and take care of them in the way that is actually appropriate for them, with their regards first. So that's a little bit about advocacy and how it's broken down. There are many different kind of facets to independent patient advocacy. I'm somebody who specializes in clinical or medical guidance. So essentially, if you're struggling with getting your doctors to listen to you, you feel like you don't have an appropriate diagnosis, maybe you have a diagnosis, but your treatment plan is not robust enough, you're still having issues, and you don't know where to turn. If you feel like a tumbleweed or a hamster on the wheel of healthcare, anything like that, medication management, any medically related issues, questions, or problems with navigation, that is exactly what I am here for and specialize in. My background is all in acute care. So I have been working in hospitals for a little over 11 years now. I started in the emergency department as a physician scribe, which was a non-clinical role. I wasn't hands-on with the patients. However, I walked around for 10 hours attached to a physician's hip, and I made the best of that. And I learned so much from that experience. I learned just as much, if not more, from that job than I did in nursing school. Very good experience. And then I went through nursing school, became a registered nurse, and I started on a step-down unit and then quickly cross-trained over into intensive care. Was in intensive care for a couple of years, and then I cross-trained to do emergency department as well. So intensive care unit and emergency room. Currently, I am just in the ER. I've also done a bit of home infusions and pre-op, pre-surgery, and after surgery, or PACU is what it's called. So that's my experience as a nurse, and I have learned so much about acute care during that time. And that's truly where my passion lies, is helping people in those most vulnerable points of the healthcare system when you're in the hospital. However, there is obviously so much value in preventing people from getting in the hospital in the first place. So now that is the focus of my practice here at Heard for Life. I'm actually about to roll out a service that focuses on prevention and being really preemptive with your health. So when people sign on to this service, it'll actually start with an in-home consultation. So this will be only available to those in Sussex County, Delaware, and the Eastern Shore of Maryland. Come into your home and we'll talk about, what's your biggest concern that's prompting you to bring an advocate in, and then also go through a detailed discussion of your medical history, your medications, your goals, your advanced directives, your medical power of attorney. Will help you set those things up if you don't have them. I'll put together an actual comprehensive medical binder for you with your medical records. We'll order them together chronologically, because let me tell you, I don't know if you've gotten into your healthcare portal, but it's really not set up to navigate well. And if you don't know where something is, if you don't already know to look for something, you're probably not going to find it. It's not a very user-friendly, or is it intuitive? So it's actually very important for you to have your own medical records and to be able to have it in some sort of a sense that you can convey a story when you go see different providers. So we'll put together that binder, and then the initial consultation also includes a multi-point safety inspection of your house, so that we can try to keep you as safe as possible in the home that you're in. One of the biggest risk factors for our elderly population is falls. That's one of the biggest things that leads to death, and most falls actually occur inside the home. So that is one of the biggest things we can do for prevention right off of the bat. Moving forward with that service, we'll actually meet just like this on a video chat every month, so we can talk about the goals that we set last month, evaluate how did that go? What do we need to improve? Is there an appointment we need to make? I can call and get that scheduled for you, and just be very preemptive with any issues that come up, because of course, the phrase, an ounce of prevention is worth a pound of cure. So I'm actually really hopeful that I know this program will avoid hospitalizations for my clients, and I'm very hopeful that the money saved by not having a hospitalization will actually kind of pay for itself with the program. And of course, the better quality of life that you get from staying well. So very excited about that program to roll out. So that's what Heard for Life is working on right now. We do, of course, also take people as they have an issue pop up right now. I'm just very excited to be moving into a little bit more of a preventative service. I think that'll really serve my community in the best way possible. So how did I get into advocacy? Well, I had never even heard of independent patient advocacy until about 1.5 years ago. And I heard about it through a patient I was taking care of. I have never actually met an independent patient advocate while working as a nurse. I've never had a patient who's had their own independent patient advocate. And everybody who I talked to about it, also across the board, most people haven't heard of it. And as soon as they do, they're like, wow, why doesn't everybody know about this? That's another part of the reason I'm putting out the podcast. Is I personally believe that independent patient advocacy is the best kept secret in healthcare. And it certainly should not be. We as a community of advocates need to be a bit more vocal that, hey, we're out here and we are doing good, and we are helping, bridge all these gaps in the American healthcare system, which is so fractured, and so many people get ill, injured, or sometimes die because of the issues in our system. And we're here to help prevent that. So I heard about patient advocacy through a patient of mine, and I was like, oh my gosh. I said, you can patient advocacy. I said, you can get a job doing that. I was like, I've been doing that, my whole career. It's one of my strongest attributes as a nurse, is advocating for my patients. It's also so difficult to do while you have all your other nursing services to do. So I was very excited about that. But then I quickly realized that you can't really get a job as an independent patient advocate. Very few advocates are actually employ a team of advocates. Most are just in business for themselves. So I was like, oof, I don't know about starting a business. That sounds like a whole lot. I don't want to do that right now. And I kind of put that idea on the shelf. And it seemed like a good time to put that idea away, because shortly after that, my husband and I became pregnant with our second child. We were expecting a daughter. Very excited about that. Until about 6 weeks later, we went for our first ultrasound and found that she had stopped growing and had no heartbeat. Now, in a situation like that, there's a few ways that it can be managed. Number one, you can let things happen naturally on their own timeline, which can take a month or 6 weeks, and that just was not the choice for me. Number 2, you can take a medication to help move that process along. Or 3, you can elect to have all of the content surgically removed. I've never had a surgery, didn't really want to go that route, wanted to just try the medication. Unfortunately, our loss occurred the day before Thanksgiving, which not only ruined a perfectly good holiday, but became a logistical nightmare with trying to access care. My husband and I were really put through the ringer. We got bounced around a couple of places. Ultimately, we ended up having to drive over 2 hours away to Planned Parenthood to access the care that we needed. And I'm so grateful that that was an option. But it wasn't a great time. And along the way, we were treated quite terribly in quite a few ways. And through that experience, I found it so difficult being emotionally compromised as I was to advocate for myself. And I had, my entire decade of healthcare experience behind me, and I would normally, know what to do, who to call, and what decisions to make. But I found out very quickly that when you're the one in the stretcher, in the bed, having all the things happen to you, not only are you dealing with any of the physical issues that go along, but mentally, you cannot access that critical thinking portion of your brain when you are in this emotional state. And I found that the same thing was true for my husband. My husband is also a nurse, but as he was going through the grieving process and watching me go through this, he also was in a place where he was struggling to access that critical thinking, that planning, that what do we do next? And we were so overwhelmed with just trying to manage all of the issues and details around getting the care we needed, that it felt like when I came through that experience, I said, losing our baby was hard enough. All the other, frankly, bullshit I had to go through should not have happened. It was through that experience that I really saw firsthand the power of having a professional advocate, of having that independent third party who can serve as the liaison between you and the healthcare system. Because unfortunately, there is a lot of fighting you have to do for care. The squeaky wheel gets the grease, and that's never been more true. And it's insane how squeaky you have to be sometimes. So once I recovered from that mentally and physically, I was determined to set out on this path and to help people to not feel the way that I did, to not be treated the way that I was, to be that voice for them when they are in that vulnerable state mentally, emotionally, and physically. And even for the person whose loved one is going through that health crisis. Imagine the power of not having to be the buffer person and to fight with the healthcare system, and just be able to be there for your mom, your spouse, your child, without having to deal with all the other frustrations that come with just fighting to get them the care that they need. So that's really where I was so intently drawn into this place. And I said to my husband, I have no idea how to start or run a business, but I know I need to figure it out. So through that, Herd for Life was actually launched at the end of May of 2023. So just over a year now. Fortunately, we were blessed to conceive again last July. And I now have a beautiful 2-month-old son who, if you've watched through all these podcasts, you've seen on a couple of them. Unfortunately, however, I did get quite ill with his pregnancy. So my business ambitions were kind of put on pause for a little bit, but I'm back in action now, here to serve the community of the Eastern Shore and Southern Maryland, or Southern Delaware, and just could not be more excited to provide this care that is so needed and help bridge some of these gaps in healthcare. I like to say that we fill the gaps in healthcare so that you don't fall through them, and you can just focus on yourself and getting better, or your loved one and them getting better. So I would encourage you, if you don't have an app, first of all, everybody has an advocate. Okay. If you don't have somebody, then you're your own advocate, which, as I mentioned, is all well and good until you do get into a position where you are so ill or so emotionally overcome that you can't properly advocate for yourself. And then you just kind of get tossed around, like throwing a tennis ball in a washing machine. It's just downright awful. If things functioned the way they should, I wouldn't have a job. I would be out of business. And I hope that one day I can be part of a positive change for healthcare, so that the kind of thing that I do isn't needed, so that the system just functions for the patient, not for, I don't know who it's for right now. I mean, there's a lot of people making money off of healthcare, so I guess it's for them. Anyways, side rant. But I'm excited to be here to serve and to help people to no longer have to go through the pain and the struggle of just getting care, getting appropriate, timely, correctly billed for care. So if you're currently your own advocate, think about changing that. Start with a friend or a loved one if you can. That is certainly better than only being able to rely on yourself. If you have the means, I would strongly encourage you to consider a patient advocate. If you're not in my area and you prefer somebody local, I would suggest that you go to the greaternationaladvocates.com. They have an online directory, and you can actually look up, I think that you can put a radius around your zip code and find advocates, independent patient advocates in your area, and it's completely free to use. But touch base with one and, see everybody, we're all independent. So everybody has their own kind of different price points and pricing structures. And there's also the Patient Advocate Foundation. They put out free resources so that you can learn a bit more about things yourself. So those would be some things to check out. But seriously, start to think about who is your advocate, and if it's you, shifting some of that responsibility to another person. So that's my hope for you. If it's me and you're interested in my services, please reach out. You can find me at www.heardforlife.com, HEARDFORLIFE.com. I do work with people virtually, and then of course only the in-person stuff, like I said, in Southern Delaware and the Eastern Shore of Maryland. So I hope this was helpful. It gives you some things to talk about. As always, if you have a topic you want to see covered in one of these videos, please don't hesitate to reach out, heardforlife.com. Thank you.